there is a risk of IVF leading to multiple pregnancy, like twin or triplets. Hi, I'm Dr. Raymond Lim. I'm a consultant, obstetrician and gynecologist and IVF specialist at Pantai Hospital, Kuala Lumpur. Today, I'm going to talk to you about what is IVF and endometriosis. How long does the IVF process take from start to finish? It depends on what protocol do we use. Mostly, nowadays, everyone uses what we call a short protocol. That itself takes about 10 to 14 days. And for IVF, it consists of stimulating the follicles to grow. This itself takes about 10 to 12 days, followed by the egg collection process, which is 20 minutes to 30 minutes. It takes about 2 weeks for the whole process of stimulating the growth of the follicles to the egg collection. Most of the time, we do frozen embryo transfer, where the whole active process takes about 2 weeks. And then we wait for the next cycle period to come on again before we transfer the embryo back in. Can IVF lead to twins or triplets? There is a risk of IVF leading to multiple pregnancy, like twin or triplets. However, as a practitioner, I normally just insert at most 2 embryos, so the risk of that happening is less. Can IVF be used for gender selection? We generally would do pre-implantation genetic screening, or in the current new term, pre-implantation genetic testing, to know and make sure that the embryo we choose for the transfer is correct. Inadvertently, we will also know what are the gender of that embryo. What does a normal sperm count look like? Normally, we measure the sperm volume by its concentration per ejaculate. So we go by minimum 15 million per milliliter. That is the minimum number needed to be counted as normal. However, we also look at the motility or the activeness of the sperm swimming and also the shape of the head of the sperm. All this accounts to man's fertility status. Can women still get pregnant if they have endometriosis? The answer is a good yes. However, endometriosis is an inflammatory condition. This may result in compromised quality of the egg, miscarriage, and also failed implantation of the fertilized egg or embryo. In addition, endometriosis itself may deter or make a woman having penetrative sex with the partner more difficult. What treatment options are available for endometriosis? Treatment options range from medical and surgical. As I said earlier on, endometriosis is an inflammatory condition. So it is important that we suppress the inflammation to increase the chance of success of pregnancy. From the medical side, you can use hormone to suppress the inflammation and thus increase the chance of success of being pregnant. From the surgical side, we remove the inflammatory lesions. However, in surgery, we still need to give the woman medicine to increase the chance of success of being pregnant. What foods should be included or avoided to manage endometriosis? Women with endometriosis are encouraged to have a high fiber diet. Foods that are supposed to be avoided are red meat, soya-based products. All this may make the inflammatory process more severe. Is endometriosis hereditary? No, it is not hereditary. If you have any question about IVF or endometriosis, you can drop your question in the comment down below.